This is Exercise for the Hearing Impaired by Kiana Campbell, EXS 486 with Professor Foster. So what qualifies as hearing impairment? To define it, there are 4 categories. Mild hearing loss is defined as being able to hear between 25 and 40 decibels. People with mild hearing loss aren't able to hear in loud places, such as the gym where there's loud music, sporting events, maybe a party. They can just have mild hearing. However, in certain loud circumstances, there's times where they aren't able to hear certain small things or something under the breath or like a whisper. Moderate hearing loss is defined as being able to hear between 40 and 70 decibels. This audience will usually need a hearing aid. Can't hear most sounds clearly without it, especially in a loud place such as a sporting event or a gym. And then there's severe hearing loss. These people can hear anywhere between 70 and 95 decibels. These people absolutely need a hearing aid. Even with one, sometimes need to rely on lip reading or repeating whatever was said, and also American Sign Language if that is the comfort of the person wearing it. And profound hearing loss is defined as needing to rely on lip reading or American Sign Language or ASL. A hearing aid wouldn't be beneficial to this group. They're completely defined as deaf. They may be able to hear things or feel noise through putting their hand on a speaker or being in a loud place, such as a football stadium. They can hear the rumble or feel it. Other than that, they aren't going to be able to hear a conversation one-on-one most of the time. Exercise precautions are extremely important to take with people who can't hear. With anybody with a disability, there are certain circumstances that you need to take for this group as well. Precautions such as not hearing certain cues. If they're doing a squat the wrong way, for example, they will not be able to hear that their knee may be going in the wrong direction. If they're not feeling something the wrong way, with this group, you really need to take the time to have eye contact with them at all times. After speaking with Raquel Westgate, an interpreter who's dealt with the hearing impaired in an exercise setting, she definitely advised that eye contact is important for the hearing impaired because they don't have the benefit of hearing. They rely mostly on sight, such as lip reading and sign language. However, if the trainer is not educated in American Sign Language, having a translator there is very important, as well as also having another spotter, considering that if you are in front of them as the trainer and they are doing a back squat, they are going to be trying to focus on you as well as the movement of their own body. And in the event that they lose balance, they will then need a spotter behind them as well, because safety is extremely important with someone with disabilities. However, in the sense of balance, because it does fall under touch and proprioception, this is heightened for them, considering the fact that they have the loss of one sense. Their others are definitely more useful and more relied on. So things to add for a trainer training someone with a hearing problem. You definitely need to be patient with this group. Training someone that isn't able to hear you means that they also may be frustrated if they aren't doing a movement correctly. It also means that you need to schedule the time with them a lot longer, considering you can't just say to them as they're doing a deadlift or a squat or an exercise test that they aren't doing it the correct way, or you can't ask them how they're feeling. It really takes time and patience and effort in getting a sense for how they can express themselves and how you can express to them doing the motion the correct way and asking for pain, or if they're feeling uncomfortable doing something, as well as if they're having any questions about if they're doing the motion correctly. As well as an important part is that their interpreter may need extra time to understand what you are saying if they're not correctly educated in exercise movement, so that they can then properly express it to your client. General effects for working out or training someone with an impairment is definitely an effect on their mood and their motivation to keep exercising. Just training the average person, it's very complicated keeping them motivated, especially if they have just begun their training. When it comes to someone with a disability, they have more insecurities, they have more concerns, they're concerned for their own safety. No one wants to be judged for doing something incorrectly, especially when they can't necessarily hear right away if they're doing something correctly or not. With general exercise, their confidence will go up as a benefit. They would want to exercise more, generally feeling stronger, feeling normal, as some would say, and more independence if they feel that they can move more comfortably through certain movements and certain tasks, such as an exercise that you would do for an elder person, just a march test or a stand and reach test, making sure that if there's something around them and the precautions they need to take, being careful if there's something placed next to them, they can't necessarily hear it if they don't feel it right away. Just feeling more independent and normal and stronger, they're going to want to keep doing something that keeps them motivated to stay healthy. The effects on exercise and overall health are very important for anybody, not just someone with a hearing impairment or a deaf person. It's exactly the same. They don't have a motor impairment. Their other sentences, as I had said previously, are heightened. Their proprioception and the way that they feel things is more improved, I will say, as the average person, because they're relying on all their senses. So when one is taken away, they can definitely feel things better, as well as if there's a mirror in front of them, they can see how they're doing things correctly or incorrectly. The important point to note on this slide is the fact that with the overall health will come the confidence, and some argue that hearing impairment and exercise are positively correlated, and that once someone starts working out, they don't feel as disabilitated as they did prior to that. So the exercise prescription is the same as it would be for any older adult, and it would be the same for a deaf child as it would be for an older child. A warm-up of 15 minutes maximum. Aerobic is anywhere from 40 to 60% of their heart rate reserve for 30 minutes, 5 days per week, which would be considered moderate exercise, and 20 to 60 minutes of vigorous exercise, 3 days per week. Flexibility, 2 to 3 days, holding every stretch for about a minute, however long that may take you, depending on what you were trying to stretch, where you're trying to improve, what needs improvement, what's prescribed to you by your specific trainer. Resistance training is to be performed as 2 to 4 sets of 8 to 10 reps with about 30 to 60 seconds in between each rep. Never training the same muscle group 2 days in a row, obviously. This can be done on the same day as aerobic exercise, different days on aerobic exercise, anywhere from 3 to 5 days per week, sometimes 6, depending on the comfort and the time of the person and the trainer, if that's predetermined. But generally speaking, it would be the same as a average adult. So the importance of observing body language with someone that's deaf is extremely important, considering some people aren't as vocal. They rely mostly on their sight and their touch. The sense of smell wouldn't be beneficial at all to exercise. With that being said, their body language is extremely important. If something looks uncomfortable for them or looks painful to them, it's obviously not something that we would want to give them as a trainer or as an exercise professional. We want to make sure that they feel comfortable, they're not going through the motions with pain, and if they don't have the benefit of having an interpreter with them, or if you're not educated on American Sign Language as the trainer, it's important to look at the way they look at the way they're moving. Are they shaking? Are they sweating? Are they making a certain face? Does it look like they're having trouble with the weight? It's important to look at the way that the person is moving and the vibe that they're giving off with their body, because it's an extra help for someone that isn't an interpreter and is trying to train someone who is impaired. With that being said, the importance of knowing American Sign Language or other languages if you are training someone who doesn't speak your language, being able to provide that person with total communication is definitely important. As a trainer, we want to have a person that feels extremely comfortable and extremely faithful in the person that they're giving their safety to. And whether that be you signing something to them, whether it's prompted, if you're not writing something down, maybe with an expo marker on a board, maybe having that communication of just writing might work for you. As I said earlier, it takes patience and time, a longer time than a normal person, to communicate with, just because they don't have the benefit of the vocal. They can't. And if there isn't an interpreter, you have to know how to communicate with them. Not every deaf person can also lip read. If they can't lip read, then you need to rely completely on another person to have that exchange of communication with you, which also takes more time. And scheduling on top of that may interfere depending on the interpreter's schedule. And hearing aids don't provide total hearing most of the time. After speaking with Raquel, she had also informed me that most of the time people with hearing aids trying to work out and working with the trainer tend to turn them off because there are so many background noises such as music, slamming weights, people having conversations. They can't focus on more than one thing because to them it's all noise. And it's very overwhelming for someone who's trying to get into an exercise scene. And the most important, the majority of deaf people would rather use American Sign Language because it does come so fluently to them and it is very comfortable with them. Overall, American Sign Language, interpreters, extra spotters are just precautions that you need to take with training someone with a hearing impairment or a deaf person. Other than that, their exercise prescription would be the same as that of a normal, healthy adult. And here are these sources. Most came from the American College of Sports Medicine, aside from the direct interview with the interpreter, Raquel Westgate. Thank you.